Hi, everyone. I'm Michelle Histand, Director of Innovation at Independence Blue Cross, and this learning burst is about design thinking. So design thinking is a 5-part human-centered creative problem-solving process. And what I like about design thinking is that it works for pretty much any problem or fleshing out any new opportunity. The other thing I like about design thinking is because it's a process, anyone can do it. So let's dive in. Design thinking is 5 steps. Step 1, empathize. 2, define. 3, ideate. 4, prototype. And 5, test. Now, we're going to talk about this in a really straightforward process, but these steps can get messy and mixed up as we go. So let's dig in a little bit. Step 1 is all about empathy. So what that means is understanding the people we're designing for, learning more about our people. And that's why we say design thinking is human-centered, because it's about the people at the center of our design. So what that means is we talk to people, we get out of the building, we get out of our seats, we learn about their experience, we ask them what works well, what doesn't, what do they need? We also do secondary research. That's our typical Googling. So we look at data, we look at facts and figures, we understand how others have solved this problem. And we take all of that research that we've done to better understand, again, our people at the center of our design and the center of our challenge. Once we understand our people, and we've really dug into that, then we better understand the problem that we're trying to solve or the opportunity that we're trying to flesh out. That's when we can go on to the define phase. So in the define phase, we take all of that research we did and we look across it and we find key themes. What are things that we're hearing over and over and over? That helps us really pinpoint the problem that we're trying to solve. So let's use the example of redesigning public transportation. Maybe we want more people to take public transit. And we start by saying, how might we encourage more city dwellers to take public transit? And off the top of our heads, we think, well, we have to reduce fare. But actually, when we go out and we talk to people, what we learn is that people don't take public transit as much, maybe because of schedules, or maybe because of their destination not meeting a close public transit stop. So this is why we do empathize and define, to really understand what people need and make sure that when we design, we're designing for the actual problem and not just jumping in without understanding the background of what people need and where they are. So once we understand that through our empathize and define phase, then we can go into ideas. Now, everyone's had ideas before. Our idea phase is about having lots and lots and lots of ideas. So we call this divergent thinking. We're developing many, many solutions using different idea tools to get to all the possibilities, even those that might seem crazy, before we dig in and settle on those that might work best. After we go through our idea phase, then we can prioritize those ideas that might work best. And then we will go on to prototype and test. Prototype and test is about taking your idea and creating a rough estimate of how it will work, what it looks like, something that works and that you can get in front of your users so they can tell us if it actually does work the way we think it will. So that's what prototype and test is all about. Testing our ideas with our users to see if it works in the way we want it to, and does it actually solve the problem the way we thought it might. So we test in smaller groups and we can measure to see how it's going before we decide if we have to make changes to our idea or if it actually works really well as is. So that's design thinking in a nutshell. 5 steps that really help us to develop new ideas, flesh out new opportunities, and it works for anyone. For more resources, you can check us out at innovation.ibx.com. Thanks.